This is Dr. Given Chipili from Mkuba University, and I'm going to make a presentation on what's new in diabetes in Zambia. I'm a nutritionist by profession, and I'm based at Mkuba University, where I'm working as a lecturer and dean for the School of Applied Science and Technology. Now, diabetes is a metabolic disease in which the body has the inability to produce enough or any insulin that causes elevation levels of glucose in the blood. There are different types of diabetes. We have type 1 diabetes, type 2 diabetes, gestational diabetes, and pediatritis. Globally, an estimated 537 million adults aged between 20 to 79 years are currently living with diabetes. This is according to WHO 2023. This represents 10.5% of the world's population in this age group. An estimated 24 million people were living with diabetes in Africa in 2021. And it is also predicted to increase by 129% to 55 million by 2045. The prevalence of diabetes in children 18 years and below between 2009 to 2019 in Zambia. So I'm looking at a study that was conducted by Simon Himalawa in 2019 with his team. It was a 10-year retrospective cross-sectional design which utilized quantitative methods involving a review of patients' case files at the University Teaching Hospital. The University Teaching Hospital is one of the biggest hospitals in Zambia. And during the study period, there was 150,563, and of those, 747 were diagnosed with diabetes mellitus. This gave a case rate of 4.9 out of 1,000. Of the 745 children that had diabetes, type 1 diabetes mellitus was the most prevalent in these children. So when you look at these statistics, you would understand that 54% is just too high for the children. Now, when it comes to type 2 diabetes in Zambia, before we look at the prevalence, we must understand that it is projected that 300 million people worldwide would develop diabetes mellitus by the year 2025. And this was reported in 2014. Now, in 2016, there were 1,839 deaths due to type 2 diabetes in Zambia, with the age-adjusted death rate of 35.64% per 100,000 of population. Currently, the prevalence of type 2 diabetes in Zambia is 11.9%. This is according to the latest report by WHO that was reported. If you look at how Zambia is faring in Africa, you realize that it is among the top 5 countries with age-adjusted diabetes between 20 to 79 years in Africa. So if you come to Zambia, it's what I've reported again in 2021. In 2011, 4.8%, and now in 2021, it has risen to 11.9%, which is a little bit challenging for the country and also for the continent and the worldwide, as it contributes to all the statistics that we are having. There are new findings from studies that have been conducted in the country recently. And these are that some adults living with type 2 diabetes in Zambia experience some physical sicknesses. They have mental ailments, poor family support, and adherence and inadequate information. Then education and communication is also a problem. So that being said, you realize that if these people are having these challenges, it's very difficult even to combat type 2 diabetes. The other challenge is that they have financial challenges and also psychosocial and in uses of daily services products such as public transportation and nutrition that they need. So when we look at these challenges, it will be very difficult actually to help these people when they are going through these challenges. And also, 50% of diabetic individuals in Zambia remain unaware of their conditions. So which means majority of the people that are living with diabetes are not even testing for it. What are some of the strategies that the government is trying to put in place? And what is currently happening is that on 15th February this year, 2024, the Minister of Health, Sylvia Masebo, attributed the surge in diabetes cases to the widespread consumption of carbohydrate-rich foods. She had emphasized the urgent need for dietary reforms and increased awareness campaign. And because of that, the country is trying to use a multidisciplinary approach where public health professionals, nutritionists, among other health professionals, must be encouraged to stem this looming epidemic. So we are trying to work as a country to look at strategies that can help in educating people that are living with diabetes. Reach out to so many people and sensitize those that have not tested by sensitizing them when they see certain symptoms to reach the nearest health center to test, and also to have support for those that are living with diabetes, and also family members to be encouraged and also to be taught on how best they can support because of the meals maybe that are being prepared in the households. Another thing that has happened in the country is that people who are overweight, we all know that people who are overweight and inactive have an increased risk of developing type 2 diabetes. And the prevalence of overweight and obesity rose to 23% in 2021 in Zambia. This was not the case 10 years ago. So when you look at all this, there is a lot of high consumption of fast foods. We've moved from the consumption of the traditional foods that we used to have. And this has actually increased because there is a massive supermarket and fast food outlets in the country. So when you look at that and looking at overweight and obesity as a contributing factor to type 2 diabetes, this can pose a challenge for the nation. And we just hope that everything that the country is putting in place to try and work on how best we can reduce diabetes by teaching people, educating people on the importance of diet and how they can manage diabetes may help the future generation and all those people that don't know that they are living with diabetes, to encourage them to test whenever they have symptoms or they have underlying issues that can cause diabetes. Thank you so much for the opportunity to present at this conference. It was an honor and privilege, and I hope Africa and the world at large can help in the fight against diabetes. Thank you so much.